50 years ago when I was diagnosed, I remember certain things about that day. Actually, prior to the day of getting the diagnosis, I remember that I had been wetting the bed, drinking a lot of water, doing a lot of, I was hungry basically, and my mom was getting pretty concerned that there was something wrong, so we had an appointment at the doctor's. So I remember going to the hospital and spending, I think I spent about 5 days, but back in those days, and I was, old enough that I could have really started learning some of the aspects of my care, but they really didn't do that back in those days. So my parents were taught everything. They were taught how to weigh the food, and my dad gave my injections. The first 2 pumps I wore were tubed pumps because that was all that was available at the time. And in about 2007, I started wearing the OmniPod. I had first seen the OmniPod in 2005 at one of the diabetes conferences. And I thought, wow, what a neat product this is, and how many people are going to be interested in using this due to the fact that, it has so few parts and there aren't any tubes and it's waterproof. There's so many features that would appeal to people, not only having diabetes, but wearing the product. Patients that I have to come across in either teaching or showing the product to relate so much better. I mean, I can even think back to when I was an educator in the hospital, just coming in and having diabetes. It just eliminates a lot of barriers between you and the patient. They know what you're going through. They know you're telling them things that you have to do that you're now teaching them. So it's not like some person out there who's never lived through it trying to tell them how to start managing your life. Recently, I met 3 other women who also have lived with diabetes for 50 years that met at camp at the same time, and we had a little reunion together. So it's really nice to stay connected with people that you knew 50 years ago and have gone through all the same struggles. As a certified diabetes educator, I'll put in a pitch for education getting covered better for those with diabetes.
I know it's a terrible disease.
I've been very lucky, but have come across a lot of people. It's been devastating.
Yeah. Thank you.
Nice to meet you. Thanks for coming by.
Yeah.
Thank you. I feel like I've been very fortunate in my life with diabetes. It has really kind of led me into my career path as a nurse and as a certified educator. It has really led me to most of the friends I have in my life who are former customers or clients, and certainly just been really my whole life.